Welcome to the information session for Language Bank's Medical Interpreter Training course. First, I'd like to give you a little background on Language Bank. Language Bank is part of Ascentria Care Alliance, a nonprofit human services organization with many programs and services, including mental health, disability services, senior care, foster care, refugee resettlement, and many more. Language Bank was started more than 22 years ago, and we currently have over 300 interpreters working for us. The criteria for training include the following. You must be 18 years of age or older. And there is a $100 application registration fee, which covers 2 prerequisite tests, a reading comprehension test and a language proficiency test. If you speak more than one language, we ask that you choose the one you wish to focus on during this training. Your homework, coaching, and language testing will all be done in that language. Later on, we can take steps to add other languages. Language Bank's Medical Interpreter Training Program started in 2008. When the program started, the course covered 45 hours of training, 5 hours over the required minimum. Our current hybrid training consists of 60 hours, including lectures, completing assignments, and participating in live discussions and coaching. All of our trainers and coaches are active and experienced interpreters. We are licensed by the New Hampshire Department of Education, and we are listed on the IMIA's Education Registry. Expectations and the workload. Students are expected to attend orientation and all 4 live discussions and coaching sessions. Students are expected to view all presentations as well as complete all quizzes and assignments to be able to move through the course. This course is a pass or fail course, and students need to score a 75% or higher on the written final. This will qualify them to take the oral exam, on which they need to score 70% or higher in order to receive a certificate of proficiency. The Certificate of Proficiency is recognized nationally and means that you are a qualified or a trained interpreter. It does not mean that you are a certified medical interpreter, CMI. This is a separate test that is facilitated through different national agencies, but our course would be the first step toward achieving that certification if it is available for your particular language. Once you have paid the application fee, passed the prerequisite testing, and are accepted into the course, the tuition is $600 payable before the class starts. There are some scholarships that are available, but only for specific language and location combinations. Scholarship recipients do not receive their certificate right away. After successful completion of the training, information will be sent to the recruiter. The student will have to successfully complete the hiring process and then work for Language Bank for 6 months or 100 appointments to receive their certificate. In addition to meeting specific language and location criteria, those interested in the scholarships must be over 18 years old, eligible to work in the United States, available during a normal 8 to 5 weekday to cover appointments, and also able to comply with specific immunization and drug testing requirements. If you are a candidate living in Massachusetts, you would need to be willing to also complete appointments in New Hampshire. We look forward to hearing from you and having you in our class. To apply, scan the QR code or visit thelanguagebank.org/medical-interpreter-training-application. Feel free to email the Language Bank with any questions you might have.